Funding for this program is provided by Annenberg CPD to advance excellent teaching.
A production of South Carolina ETV.
We have a real emergency in America today. Half of children under age 2 have not been vaccinated against killer diseases like German measles, polio, and meningitis. 9 million children have no health insurance. 1 million teenage girls will get pregnant this year, and millions of teenagers will contract sexually transmitted diseases. Thousands of children will be shot and die. All these crises and not enough care. For millions of children, the hospital emergency room is their doctor's office. Either there's no insurance or not enough money to pay the doctor or no doctors at all. And so routine problems, colds and earaches, that should be treated routinely in a doctor's office become crises. Bronchitis and even pneumonia, ear infections and even deafness that end up being treated here. A hospital emergency room for children is also a symbol of an underlying crisis. If many of our children don't have proper health care, through no fault of their own, obviously, generally through no fault of their parents, how can we expect them to learn? What chance do they have of reaching their full potential, of becoming productive members of society? It's really as simple as this. Healthy children can learn, unhealthy children cannot, and learning matters.
They're curious about having sex.
And they refuse to teach us about AIDS, even though it's a deadly disease in our world today.
We've got to educate our children. We've got to educate parents. We've got to educate our society on the things that they can do to improve their own health.
Los niños de ella le hacen lo mismo igual. O sea, tienen esas reacciones y es normal. O sea,
me dice, mami, me voy de la casa porque tú ya no me quieres.
He says, Mom, I'm going to leave the house because you don't love me anymore. But then he apologized later on.
It's okay. It's okay.
Learning Matters is made possible by grants from the Lilly Endowment of Indianapolis, Indiana, and the Pew Charitable Trust.
Not all emergency rooms are overcrowded and chaotic. Here at Children's Hospital in Little Rock, Arkansas, 60,000 children are treated every year. But as in most emergency rooms, the majority of the cases treated are not actual emergencies, but medical problems which could easily be prevented. Dr. Jocelyn Elders, head of the Arkansas Department of Health, is President Clinton's choice for Surgeon General of the United States, the nation's chief health officer. As she toured the pediatric emergency room with Dr. Robert Glenn, they discussed the importance of prevention.
Children come in with maybe measles, a thing that we've forgotten about in the past. Measles can cause meningitis. A lot of people don't realize that. And if we could be sure that 100% of our children get immunizations, we wouldn't be faced with that. The other problem is, in our insurance industry, they will pay for somebody to come in and have measles, meningitis, but they may not pay for the immunization. A lot of the policies don't pay on that front end. And we know that maybe she has better figures. For every dollar we spend on immunizations, we can save about $10 long term. Is that about right?
That's about right, 10 to 14.
Would you like a law? All children must be immunized, say, by age 2?
Well, I think what we were saying, appropriately immunized. And see, that requires several kinds of immunization. And, I'm hopeful.
Would you like a law?
I'm hopeful that we'll be able to get it done without a law.
Would you like a law?
To require all children to be appropriately immunized by age 2, or parents be charged with child abuse. Yes. And it is a form of abuse.
What's your view of that, Dr. Glenn?
Well,
she's just said a law saying children must be appropriately immunized by age 2.
One of the problems we have is that there's not enough money available for the immunizations, to buy the immunizations. We have that problem here in our state. There's not enough money available to immunize all the children. So that's the first. We have to be able to purchase the vaccine first, or figure out some way to get enough vaccine so we'll have enough to immunize the children.
Would you support the law?
Whether, if we can't educate the people and we can't get them immunized, we have to do something. Yes, I would support that if everything else fails.
Insurance is one problem. Money is another. In the last 10 years, the price of a single shot to prevent whooping cough has soared from 45 cents to $10. Prices like these may help explain why only about half of all 2-year-olds are properly immunized. But for Dr. Elders, the underlying motivation has to be education.
We've got to educate our children. We've got to educate parents. We've got to educate our society on the things that they can do to improve their own health.
So you sound like the Secretary of Education. You're the Surgeon General.
Well, if you can't educate them, I can't keep them healthy. And you can't educate them if they're not healthy. So health, there has to be a marriage between health and education if we're going to make a difference.
Health and education are married in one federal program, Head Start, the early childhood program for disadvantaged 3- and 4-year-olds that began under President Lyndon Johnson in the mid-60s. Head Start is widely credited with providing preventive health care and basic nutrition, as well as education, to millions of children. We went with Dr. Elders to a Head Start center in Little Rock.
That is Dr. Elders.
Dr. Elders.
Right. You know, I'm always happy when I come into a Head Start center. Usually you see happy, healthy, pretty well-fed kids. You know, I'm not looking in their mouths, but, you know, for the most part, that's what you see in a Head Start center, because I think a part of all Head Start should be health, education, parenting education, and parental involvement.
Head Start provides 2 meals a day, a full physical for those without health care, vision and hearing checks, as well as a dental exam. Health Administrator Mary Gupton explained that most of these children had never seen a dentist before.
We have approximately 800 and something children in our program. Then you have the majority of those children, it's their first time ever having a dental swing on it. You know, I would say over 85% of the children have enrolled
receive no dental care.
No dental care.
That's typical of Arkansas.
This Head Start program is full. You have 180 kids. Do you have a waiting list?
We have a waiting list, and we have 17 centers throughout Pulaski County. So just about all of them have a waiting list.
Where do you suppose those kids are, the ones who are on the waiting list?
They're home, and usually they're the poorest children. Usually they're children born to children. You know, they didn't know to go in and start and apply early. See, many of these children, their parents probably work. They may not have the highest paying job, but most of these children's parents work. They're not the teenagers. They're not the children at greatest risk. So the children that we're neglecting the most are the children at greatest risk.
That's a recipe for disaster.
Absolutely. Well, all we have to do is look around and realize that it's approaching.
Dr. Elders would like to see every child enrolled in Head Start or some other preschool education program.
From what we already know, we know the children are half as tall as they'll ever be by the time they're 3. They know half as much as they'll ever know by the time they're 4. Hope, will, and drive has been determined by the time they're 5. And if we fail to give them a good start, they're behind, they stay behind, and they never catch up.
Should it be an entitlement? Should every kid be entitled to Head Start?
Absolutely. That's the best thing America could do to improve their health.
Head Start as a basic right.
Head Start should be a basic right and entitlement for every child in America.
Head Start is fine as far as it goes, but it reaches only about 1/3 of the eligible 3-, 4-, and 5-year-olds. The situation gets worse as children grow older. Health problems become more complex, solutions are harder to come by, and there is no national program like Head Start to address the health needs of school-aged children and adolescents. Most of our 90,000 public schools provide little or no access to health care. This high school is pretty much the norm. 1,800 students, a nurse who visits only 3 or 4 times a year, and a health office staffed by a well-meaning but undertrained clerk.
No, I'm not a doctor. I'm just a health clerk. I just handle the students that come in. If they're sick, you know, they feel like they're feeling sick, and if I see that they're flush and they have a little bit of fever, all I can do is call their parents up and ask them to come pick them up.
Can you take their temperature?
Yes, I can take their temperature. I cannot take blood pressure.
Can you give them an aspirin?
No, I cannot give them aspirin. Any kind of medication, I cannot give them.
Not even aspirin?
Not even aspirin, no.
So a high school with 1,800 students.
You can't do anything for them.
As a clerk?
Can't do nothing.
And high school students have problems that require more than aspirin, much more.
Well, I had my second day working here, I had a student in labor. I couldn't do anything for that student. I felt really bad. I know a little bit about labor because of my experience. All I could do, and I asked her when she started the labor. I asked her when she was due. She said she was due that Tuesday. This happened on Thursday. She said she was due on Tuesday, so I asked her what the labor felt like. And, I couldn't do anything else for her. All I could do is just have her sit and, ask her if sitting or walking made her feel comfortable to do it. I called the mom. The mother couldn't come pick her up, and she had to get a neighbor to come pick her up, and she was 5 minutes apart by this time. I was panicking. Well, I wasn't panicking, but, I knew that if I had to, at the last resort, call, 911 and have someone come get her. But I couldn't do anything for her at all, except make her comfortable. If you get a student that faints, what do you do? I had a student walking out. She called me. I had another student run in and said, something's wrong with this student. I took a wheelchair out and helped her, brought her back in, had her lay down. She had a hard time breathing. I called home, and apparently she was born with a heart problem. And I called home and had mom come pick her up, take her to the hospital. But there's nothing else I could do for her. Yeah.
Except hope.
Except hope. Yeah, make her feel comfortable until someone comes. Yeah. We feel like our hands are tied, especially, when we see that a student really needs help and we can't do anything for them. Yeah.
And there's a need? I mean, there are a lot of students.
Yeah, we have a lot of low-income students that are that get sick, and they're flu and they get sick, and they don't go to the doctor because the parents don't have money to pay for it. And so they stay sick for a while, and they miss a lot of school.
The adolescent health and medical problems, which that all too typical high school is not equipped to cope with, include alcohol and substance abuse, depression, anorexia and eating disorders, violence, sexually transmitted diseases, including AIDS, and teenage pregnancy. What do public schools do to prevent teen pregnancy? Wall posters seem to be the method of choice. Schools put posters where kids cannot avoid seeing them. How effective is poster education in combating teenage pregnancy? Not very. The United States is #1 in the world in unplanned teenage pregnancies. Every year for the last few years, over 1 million teenage girls have become pregnant. It is an epidemic of babies having babies. At least some of the teens wish they had waited.
I wish I would have waited. When I brought my baby into the world, I wanted to have a career and a good education, to offer my child.
Did any of you plan your pregnancy?
No, not me.
I ain't playing mine. I just didn't care. I'm going to tell the truth. I just didn't care whether I got pregnant or not.
You want to get pregnant again?
No. I really care now. I really care now. I'm doing everything to prevent pregnancy. I'm trying anyway.
Do you wish you hadn't had that baby so early?
I wish I would have waited. I wish I could have waited. It would have been better if I would have waited. But a lot of us girls have a lot of help. And I thank my sweet Jesus of the help I have.
Do you wish you were having this baby later on?
Yeah.
Do you wish you'd waited? Now, this is your second child you're about to have. Do you wish you would...
Oh, yeah. I wish I would have waited for my first one, too.
The Baltimore school system has come up with one approach that it hopes will help teenage girls avoid unplanned pregnancy. At the Lawrence Paquin School for Pregnant Girls, the health department is making the contraceptive Norplant available. Norplant is a surgically implanted birth control device made up of 6 matchstick-sized capsules inserted under the skin of the upper arm. The capsules release a hormone to prevent pregnancy and can be left in the patient's arm for as long as 5 years.
I said after I had my baby, I was going to get the Norplant and I was going to try it. And if I ain't like it, I was going to get it out because I can't take the pill. It's too much.
Dana?
I'm going to try the Norplant.
You are?
Because I don't want no more children at this young age.
A lot of doctors at the maternity center, and when I had my baby, asked me should I get the Norplant, or they wanted me to get the Norplant, but I said I didn't want to get the Norplant because all my friends that have the Norplant, 4 of my friends had the Norplant, and all 4 of them got it out.
Providing Norplant to students is a mistake, according to Dr. Ronald Valenti, head of the Catholic schools in Baltimore.
Yeah, we're saying kids, you're sexually active, and probably that's the only thing you can do, and that's probably your level of your response right now, so therefore we're going to help you along. And we're going to give you something so that you can continue to be sexually active, And now there's a security, quote unquote, that with your sexual activity you don't have to worry about a pregnancy. So it seems to me that the problem is much deeper than the idea of what we're experiencing, and we're not really addressing it. I think it goes back to the idea of a certain amount of an education about what it means, the sexual activity. What are the consequences with that? What is the responsibility attached to that? Where do we see the sexual involvement? Is it within the context of this kind of quote-unquote promiscuousness that we experience, or is it within the context of a kind of relationship that means a giving, a sharing, a commitment? The schools now are distributing birth control pills, diaphragms, condoms, Norplant, and it seems that every year we're adding something to try to solve the problem, and yet the problem is not going away.
Malaika Reed also has doubts that Norplant will work, but for a different reason. She says that some girls get pregnant on purpose.
A lot of these pregnancies are not mistake babies. These babies are planned babies.
Why would a 15-year-old girl want a baby?
Right. So I'm gonna give you an example. A 15-year-old girl can be going with an 18-year-old boy with money. Okay, and she feels as though a lot of these other girls out here is a threat to her. So she thinks that if she get pregnant and have his baby, that she's going to always be in his life, that she can keep him, and it's going to always be her no matter what. So they can have this kind of bond with each other.
Is she right?
No, she's wrong. She's very wrong. But I'm giving you examples of how these babies are playing. Some girls do it to make themselves seem grown, because they like to make themselves seem like a big girl or whatever, which it don't make you a big girl. A lot of girls do it because their friends think she wrong there too. A lot of girls do it because they see all their girlfriends have babies or whatever, so they want a baby.
Is she right?
She wrong. A lot of girls do it so they can dress their baby all slick and stuff like that. She wrong again.
But they're planned. But they want the baby.
If Malaika Reed is right, that some girls are getting pregnant intentionally but for the wrong reasons, then it's unlikely that any form of birth control will work.
The Paquin School is providing a physical, biological way of avoiding pregnancy. Another high school in Baltimore has taken a different approach, a full-scale health clinic that has become a sanctuary, a place where the teens know they can come for answers to all their questions.
When I came down here and I asked about birth control, or I asked about, personal exams, they were very kind, they were very nice, and they let me know up front, if you don't want your parents to know, then they don't have to know. And when I started on birth control a while ago, and I didn't want anyone to know. That was something that was very personal to me, and I thought my mom would flip out if she knew.
You're comfortable that it's confidential?
Yes, I am. Very comfortable. Because, right now I'm living with my father, and I feel that it's kind of hard for me to tell him that I need birth control pills or some kind of contraceptive. It's kind of hard talking to a father. So I feel that being confidential is very good for me.
The school provides everything from sports physicals for athletes to treatments for asthma and basic care for those who can't afford a doctor. That's important when you consider that across the United States, 1 out of every 7 children has no health insurance. The clinic also runs voluntary group counseling sessions.
Today we're going to talk about relationships and developing a relationship not only with your peers but with your family. What you feel a relationship is better?
The relationship is like between you and the girl, like y'all got something going on and y'all want nobody else to come between you.
But sexuality is the dominant concern.
They asked me a lot about my history, as far as my medical history and if I was sexually active, how sexually active. They asked me all the questions that they needed to know to make sure that I was the type of person who could get on birth control. And at the time, I had one steady boyfriend, so I just wanted to make sure if we did become sexually active that I could be protected. And they gave me condoms as well, and they always said that don't use one without the other. Better safe than sorry.
But they didn't make judgments.
No, they don't sit there and say, well, if you're going to be sexually active, then I guess I'll give you. They were always very nice. They were very cooperative.
Sharon Robinson was already pregnant when she moved to Baltimore from New York City. When she started getting warning signs, she visited the clinic.
Now I come down here every Wednesdays for, classes about the pregnancy and stuff like that. So it's real confidential.
When they found out that you're pregnant and told you, Did they counsel you that you could have an abortion, that you could carry the baby?
Actually, she says it's up to me what I want to do. You know, she didn't go into the abortion thing. She asked me if I was going to keep it. And I said, you know, I had to think about it. You know, it wasn't a shock because I know, you know, but it was a shock to, you know, that I'm in that position. And I was like, what I'm going to do, you know what I'm saying? So I had to think about it, and I told her that I would come back. And, you know, she says, okay, fine. It's your decision. You make your decision.
Does making contraceptives available to teens promote sexual activity, as critics have charged?
I've heard a lot of people say, you know, well, it promotes sex and it says that, you know, it's okay to have sex. And I don't feel that way at all, because anytime you go in for a counseling session, they let you know right up front, you know, we're not saying that this means go and have sex. You know, let us make that very clear. And they tell you all the precautions you need to take. They tell you all about sex, period.
Kids might try to take advantage and say, well, since I got birth control, I know I can just go out and do it. But I feel that when I was taking birth control, it's not like I was going to do anything. It was just being safe, you know?
Like she said, abuse the privilege. And then, you know, next thing you know, 13-year-old girl having a baby, and the father and the girl getting left by the father and everything. That's the only disadvantage to it.
I think if parents, you know, sit down and talk to their child about sex and about birth control and about sexual diseases, you know, and, you know, tell them that you could come to me anytime and talk to me, and you don't have to go out and, you know, explore or investigate about it, you know.
Should I say, son, daughter, I don't think it's a good idea for you to be sexually active, but if you're going to be...
No, because you will tell the child not to do this and not to do that, and that child is going to go and do it anyway because it has a spine of its own. Now I'm having my baby, and it's going to be a girl. I would sit her and I would tell her, you know, it's your decision.
You know, I would do everything, draw diagrams if I have to make him understand, and I would basically tell him or her, before you're ready, well, if you're ready, come back to me and I'll, you know.
At what age?
Whenever they asked. But if it was an absurd age, like 8, 9, 10, 11, something like that, no. I would tell him he's not ready yet.
You know, someday you'll have children who will be 13. Do you want them to be sexually active at that age?
No. These days, I think that the parent should get a more, you know, friendly, you know, relationship with their child, being more of a friend than trying to, you know, be so hard on it, like, you better not do this, you better not do that. Because if you tell them you better not do it, they're going to go do it.
Yeah,
so you might as well, you know, get a better, you know, relationship with your child. You know, talk to them, tell them everything. And anything they want to know, you tell them. And then, you know, you let them know when you're ready, come to me. You know, I take you down to the clinic, whatever, you know. Yeah.
Answer anything.
You know, anything they need to know. Because if you leave something out and they want to know and you won't tell them, then they're going to go, you know, try to find out on their own, the hard way.
Mm-hmm. They're curious about having sex.
So your rule is, if you're old enough to ask, you're old enough to be answered. Students ask lots of questions, and not just about sexuality. They want to know about threats to their own health, about sexually transmitted diseases, including AIDS. We asked our student reporters to find out how much students are learning about AIDS in school.
Absolutely nothing. It's really appalling in our school. They claim they're preparing us for life, but they're really not, because sex is a part of life, and they refuse to teach us about AIDS, even though it's a deadly disease in our world today.
Through the university, no, I haven't really seen anything around campus much that's caught my attention about AIDS. I'm sure there's been lectures and such. I haven't sought those out, though.
I remember we went on a field trip to a hospital, and we actually heard stories of people that had diseases, and I found it really informative because it touched us in real life. It didn't become just a problem that we read about in textbooks, but it's a disease that's around us and affects everybody.
You can't get it, you know, just by holding someone's hand, but there are many ways that you can prevent from getting it. It's a very preventable disease.
There are posters and pamphlets pretty much everywhere you look. It's in the school paper, magazines, and such. And when I walked into the University Health Clinic today, there was a basket of condoms with little information packets on it, first thing you see when you walk in the door. So I think they're doing a pretty good job.
Every month on this program, we recall a teacher who's made a difference. Dawn Marsall certainly fits that description, even though she wasn't a teacher by training. This is her story.
What do you feel like?
Dawn Marsall lives in San Francisco with her husband, Henry, and his son, her stepson, Christopher, who's 9 years old. On weekdays, Henry takes Christopher to school on his way to work. Then Dawn goes to her job. It's really volunteer work, educating high school students about AIDS.
I say a prayer, actually. What I do is when I go into a classroom, I say, you know, God and universe and whoever's out there listening, help me to say what I need to say today. Help me to say the right thing to get through to who I need to get through to today. Because maybe there's one kid in that class I need to get through to. I'm 25 years old and I have AIDS. When I was a teenager, the one thing that I really wanted to do was to find some wonderful guy and fall madly in love and have this great romantic relationship, right? And the big mistake that I made was that I believed it when some guy would say to me, hey, Dawn, if we have sex, that's going to bring us closer together. That's going to make our relationship stronger. I believed that, and I had sex with the guy, and I got hurt. I got dumped. I did all kinds of really crazy things. I tried all kinds of drugs. When I was 17, I tried IV drugs. It was just something new to try. And then something strange happened. I grew up. I stopped doing drugs. I finished high school. I went to college for a little while. I got a really good job in an office. I met this wonderful guy, and we fell in love.
Dawn goes on to tell the students that she and Henry were married and that after several years, she became pregnant with Lindsay.
I have baby pictures. I'm just going to pass them around. You can't get AIDS from touching these. I'm sure you know that. And I passed around her picture in the middle of the story as I'm telling what happened, and they don't know. And they see this cute, healthy, chubby-looking baby, and they think that she's still here.
Lindsay had health problems from the very beginning. She was in and out of hospitals. Then one day, Lindsay's doctor asked Dawn if she or her husband were drug users. They weren't, but Dawn had been as a teenager. Frightened, she went to be tested for AIDS.
Every night I'd go to bed and I would pray, and I'd pray to God, and I'd pray to Jesus, and I would pray to the Buddha, and everybody good, didn't talk to the evil guy, but talk to everybody good, and I'd say, hey, God, if I have to have this disease, fine, I can accept that. If I have to die of this disease, that's fine too. But please, God, please not my baby, not my daughter. She's my whole life. She's everything I live for. Don't make her have to pay for my mistakes. When Lindsay was 18 months old, she died. That was 2 years ago, so Mother's Day wasn't exactly fun for me. What I say to people, what I'll say to you, is that whether it's sex or drugs, the few minutes of pleasure that you get from those things are just not worth all the years of pain that you can also get from those things. And that it's really, really important that you love yourselves and you care about yourselves. And it sounds kind of corny, right? But when I was a teenager, I didn't like who I was. I guess I didn't think I was pretty enough or tall enough or skinny enough or whatever enough. And so I did things to hurt myself, and I let other people do things to hurt me. And it doesn't have to be that way. You have to put a human face to it. You can feed people and children statistics until they're blue in the face. They're numbers. They're things on paper. I've had hundreds of children say to me, I heard all the information. I read all the warnings, and I saw the statistics, but I just didn't get it until you came in and talked to me. It didn't hit home till I saw a real person with a real life and a real story.
I mean, if you could make a bargain and you had the choice, Dawn, you have to stop doing all this school stuff and not talk about HIV, and you can live to be 80.
No.
Or you can keep on doing this school stuff, but you only live 2, 3, 4 more years.
No, you made me cry. I never thought of it in that way before, but no, I think I would choose to live the 4 years and make the difference because, how can you say this? You get so much out of giving.
What Dawn taught us was how to be involved, how to feel as opposed to know. And I think if you look at the way in which people with AIDS were depicted before that, there was a little box with their head, and then they told their story in 10 seconds or less. My baby died of AIDS, or I have AIDS, or an empty bed, or a cemetery. So they became almost a symbol. They weren't a real person. But Dawn was a person. Dawn was a person with a story, a past, a present, and a future. And her future was dedicating herself to being an HIV educator.
Dr. Karen Hine knew Dawn Marsall well. Dr. Hine founded the nation's first clinic for adolescents with AIDS in the Bronx, New York.
How do we do here in the United States when it comes to educating young people about HIV compared to other countries?
Well, in this country, we are at a very particular moment, and it's a very critical one. We got one foot in the Victorian era and one foot in the real world. And we could compare ourselves to a few other countries. For example, in Finland, another Western industrialized nation, the Department of Health, which is a governmental agency, has now mailed to every 16-year-old in the country a very explicit brochure with pictures of teenagers and a condom. So that's a very proactive government, a very, I think, socially responsible act on their part, as compared to our government up until now, which has really been tiptoeing around the critical issues that teenagers need to know not only how you get this virus, but how you don't get the virus and what will help to reduce risks, namely condoms. A recent example of a quite misleading ad campaign that was produced by NIDA, a federal agency, showed
National Institute
of Drug Abuse, was trying to get teenagers to make the link between drug use and judgment and unprotected sex. Okay, so here's what they did. They put out a poster, a couple of posters in English and in Spanish, with a picture of teenagers making out in a car, and then a picture of a car wreck. And the text says something along the lines of, Vanessa was in a fatal car accident last night, but she doesn't even know it. Okay, now let's just stop there for a moment. What in the world is a teenager supposed to make of this image and message?
Kissing kills.
Right. And maybe what they're supposed to say is, aha, well, if I'm in a car and maybe we make out, then maybe that will lead to sex, and maybe it'll be unprotected, and maybe I'll get HIV, and then maybe I'll die. Okay? That kind of...
That's what they intended?
That's the only way I can put it together. And what's really unfortunate about that are three things. The first is it gives the wrong message. In fact, we want kids to kiss and hug and pet and make out. Those are absolutely risk-free, and they're also pleasurable. Secondly, that it's very indirect. And thirdly, it doesn't tell the teenager what they're supposed to do. It tells them what they're not supposed to do, even if you agree with what they're saying.
Fortunately, other innovative ways are being developed to help our children learn about diseases like AIDS. When children, parents, and teachers are uncomfortable talking about sexuality, technology can come to the rescue, according to Fred D'Ignazio, our regular guide to learning technology.
What we're seeing is an interactive computer program that is enriched with video discs, which are laser discs that depict many of the dramatic video shots of AIDS victims and AIDS educators and health officials. But it's really what I would think it's a textbook of the future, or a survival guide of the future for adults and for kids. It's partly a manual, so you can read about it. It's partly a computer program that you can click and interact with. And it's also a lot of very dramatic video segments like TV.
For those who are sexually active, condoms, also called rubbers or prophylactics, have been shown to help prevent the spread of sexually transmitted diseases. That's why condoms are recommended to help reduce the spread of AIDS.
Watching AIDS victims who are suffering from the disease, watching situations in life that make you feel much closer to the impact of the disease on other people's lives.
And as you select highlights to watch, the Spanish translation will be available as an option on the second audio channel. Study and learn. The best protection against AIDS is education.
What the computer does is the computer allows you to open this window and meet many people who have AIDS, to meet people you would never otherwise get a chance to meet, and interact with them directly by calling them up on the screen, by clicking again and getting to hear them a second time, by going to listen to somebody else. It's kind of like having electronic guests come into your classroom, and you're the master of ceremonies.
I want to do casual contact with aids too.
Okay, we'll do that next.
This is a product that a whole school should buy because you can put it on a cart, you can put a TV set on top of the cart, and then you can roll the cart around the building. And what you have here is the latest electronic chalkboard.
You know that the information on the laser disc has to be correct, but you're never sure, like, I don't know if my parents know more than I do. I don't know if, like, even a school counselor or my principal would know more than I do about AIDS, and they might hold some of the same myths that a lot of the people in this country hold, you know, and I might get misinformation from them or something.
Katie and her friends are absolutely right when they say they're not sure if their parents know any more than they do. We don't. Maybe we know less than the kids do because maybe we're not feeling the heat. We're not on the spot here like our teenage children are. This is a social kind of product. You ought to have a couple buddies. You ought to have a couple friends like Katie does and put them, sit them down, and this should be like a discussion starter or a debate starter. It's a super product that's going to have a big impact on young people, but only if they're aware of it and we can get it into their hands and get them to explore the way we've seen Katie and her friends explore it.
Learning and health are inextricably bound together. You know the old expression, a sound mind in a healthy body. Some people, including Bill Clinton's choice for Surgeon General, Dr. Jocelyn Elders, think that school is the natural place to provide basic age-appropriate health services.
20% of our population is in school every day. If we provide primary preventive health care to our children, well, then we can make a great difference.
Apparently, Dr. Elders is in the minority, however, because it's not happening. Only 450 public schools out of 90,000 have health clinics. That's 1/2 of 1%. 8 of those clinics are in one city, San Jose, California. They provide health services to about 20,000 students, some of whom have never seen a doctor in their entire lives.
See, he's still got all this congestion here. Okay, open up. Let's take a look at the throat. And he's still real red back here. You want to see, Mom? So even though he came up strep negative, there are other kind of bacteria. What do you do with these children? Well, before they stayed at home until they either got better or they got bad enough or worse and had to go to that county hospital. Now we catch them early. Like now I saw this child who's on the appropriate medication. He's going to be rechecked in 3 days. There you go. And all of that service is provided right here on school.
I would say we're supporting the family in many ways. The parents see it as a support service. And the key to our children's success and future is their education. In order to provide that education, we need to make sure we have children that are well.
We'll let him go ahead and stay at school.
Do you have confidence here, though? I mean, these are not doctors. Sunshine is a physician's assistant. She's not a real doctor.
I do have confidence in her, yes.
So you feel pretty good about this?
Yeah, I do. I feel it's better than not being able to see anybody.
How important is a school-based clinic like this to you, then?
Well, if we didn't come here, then we would have to probably wait until if something more serious happened and then go down to the emergency. Or either that or we just doctor ourselves up at home. Try to stay well and healthy.
The first year the clinic was open, we started the kindergarten physicals. This child came to us, and he showed up with Mom, and they came with diapers, and she said that her child had been born with spina bifida and could not walk, and that he had no control over his bowel or his urine, and that he had to come to kindergarten, and here were the diapers, and she was told that the clinic would change this child's diapers. He would not even help change his diapers. He was totally dependent. Ask Mom how's he doing with his urine.
¿Qué tal va como con la orina?
Ya me hace pipí él más, o sea, él solito, él ya me hace así pipí.
He can do the urine by himself now.
¡Está bueno! ¡Es muy bueno! ¿Sí?
Y cuando lo hace, o sea, le dice usted algo para animarlo, para que lo esté haciendo muy bien.
Now we've worked at the small little baby steps first. It was things like put your own shoes on after we would change him.
How is it that he'd gotten so far along, and
How had he fallen through the cracks like that?
This is pretty common with our kids out here, that our children that are low income, no income, are Medi-Cal recipients.
She says that he's doing a lot of things that the doctors told her that he was not going to be able to do.
She is a working mom. She does have a job, and she is self-sufficient in that way. But as the time went on and appointments had to be made, she couldn't get to the appointments.
So the system tried.
The system was there in place that was offered to him, but again, access was the problem. And that's the point of this clinic. One of the focuses for the clinic is to try to take some of that pressure off a system that is already so inundated with really needy people. The goal is to show her, who has a chronic ill child, that she has resources and there's a light at the end of that tunnel. Do you remember when you and I first met?
¿Se acuerda cuando la primera vez que ustedes se conocieron?
And you came with the diapers?
Vino, dice que venía con los pañales para el niño.
And that was only a year ago. And look how much you've done in
hace un
1
año.
year.
Y dice, y vea el resultado, o sea, lo que le está ayudando al niño. Lo bueno que está resultando todo esto.
Yeah. And so if we work hard, probably 1-2 more years of school, he will do all the work. And then you won't do as much. As he gets better at doing it, you'll do less. And that's what we have to do as moms. Work hard at first, and then let go. We started very small, and then as he progressed, we kept rewarding him, and we kept positive stroking the mother about her involvement. And what we see now is a very successful little boy with a lot of emotions. Tell her she's done the best gift she can give her son. She's teaching him independence.
En toda la vida del niño.
En ocasiones me desespero y lo regaño y me dice, tú no eres buena mamá, tú no eres mi mamá.
Sometimes she gets very desperate and upset, and so he tells her that she's not a good mom.
Pero luego llega más al rato y me dice, mami, perdóname.
But then he goes back and tell her, apologize and ask her for forgiveness.
Yeah. Well,
because he knows.
And mi niños do that to me too.
Dice, los niños de ella le hacen lo mismo igual. O sea, tienen esas reacciones. Sí, es normal. O sea.
Me dice, mami, me voy de la casa porque tú ya no me quieres.
Yeah. He says, Mom, I'm going to leave the house because you don't love me anymore. But then he apologized later on.
It's okay. Okay. You see the mom and the son both crying and very feeling. This is very positive. I mean, people may view this and say, oh, my goodness, look at those poor people. That's not it at all. She is crying for a release of the frustration. Tell Mom that she always has us to call.
In the elementary school, we found that we've been able to do a great deal more prevention. We're finding children who have high cholesterols that we can intervene in early. We're finding children, like some of the children we saw this morning, who have developmentally are delayed and other difficulties that we can intervene in and can really be effective. In the middle school, we get into a lot more of the very, very early risk behavior.
I was playing football. I tripped on my shoelace and I fell.
And we're starting to see children at those ages in the 6th, 7th, and 8th grades who have already begun experimenting both with sexual activity, with substance abuse, with alcohol, with other things that are definitely going to serve as a health problem. However, at that age, they're usually still reversible, and we can begin to deal with them.
If you move back and then lie down, okay, this will be, and just put your foot out here, that'll be a lot easier.
I noticed as you were taking care of this young man, you started talking to him about being in school, and there's a kind of a counseling quality to the conversation you were having.
Right, and Jarvis and I are acquainted from before, and we've had some other discussions, and yeah, that's sort of, you sort of have to look at the whole person when you're treating somebody, and I think particularly in this age group, it's probably going to burn a little bit though, okay?
Okay.
And just see if you feel like you really can't tolerate it, then take it off, okay?
Do you have a kid who will come in here for I don't want to say the hangnail, but the physical problem, and then will open up and start talking about the emotional burden that he or she is feeling?
Yeah, I think that develops, that maybe would ensue Usually it's after you've gotten to know the kids a little bit and you sort of develop a little rapport with them that those things would come out more likely. Some kids are very open and very expressive. Oh, just off the top of my head, I would say maybe half of them have some difficulty, alcohol or drugs or single parent or some disruption of the family or other such problem going on at home. So I think a lot of these kids are really at high risk.
You know, I had this sense of commitment, purposeful activity, good deeds, held together with string and baling wire and prayer.
That's a lot of it. Financially, right now, all social services as well as medical services, particularly in California, are undergoing cuts. Health departments are being cut, county hospitals are being cut, county mental health is undergoing enormous cuts, county substance abuse is undergoing cuts. All of the services for our children are undergoing reductions at this particular time. And
how great is the need?
The need is enormous, and the need is increasing.
But I get to talk to her baby a lot. Hi, baby. All right. I just want to feel.
Pregnancy, prenatal counseling, birth control. How much of it is that a major part of your service?
Yeah, it is. For me, for the medical clinician, it is. I would say half of the female students that come for either contraception counseling or prescribing or pregnancy testing.
The young girl who was here
You're not having any pains in your back.
Well pregnant,
yes.
Married, but she's going to have her baby and then could be able to come back to school.
Mm-hmm. And that was why we started the prenatal program here, was for students that didn't want to leave the school. A lot of these students have been here for 3 years, and their friends are here, and they know the school, and they know the teachers, and they feel real at home here. And previously, students that got pregnant had to transfer to a different school, and number one, we wanted to make sure that the outcomes of the pregnancy are good, and that these ladies have healthy babies, and that they're healthy themselves, and that they can stay in school here. And that was kind of our reasoning behind starting our program.
How do you answer the argument that this is a bad thing to do because it encourages sexual activity, it doesn't teach the kids that sex outside marriage is wrong, all that?
Personally, I think that it's every person's choice to do in their life what they do, and to face the consequences of their action. And I don't advocate teenage pregnancy, but I am here to support any student, no matter what's going on in their life. And, you know, for some teenage girls, they get pregnant. And I would rather them not be pregnant, but I'm here to support them if they are. Mary Grace needs to be home today. She needs to not be in school. So if you can write her.
Okay.
Thank you.
Okay, thank you.
All right, my dear. It's your turn. Irene's going to write you a pass, so you're not cutting today.
Yeah.
Okay? And I will see you tomorrow between 10 and 11.
Okay.
Okay. And tell Victor not to worry. Everything's going to be fine.
In the high school group, very honestly, we're seeing a lot of the results of the risk behaviors. We're seeing the children who are already addicted to substances, both alcohol and drugs, who are already pregnant, who already have experienced sexually transmitted diseases, who already are failing in school, maybe beyond redemption. But they still have acute health problems that need to be dealt with.
You have in this office a couple of copies of a note, a 14-year-old, something that she wrote after a suicide attempt. Is that a serious issue at the high
Yes, it's
school?
very serious at the high school level, and it's hard to. It's pretty common, and we don't know actually how many attempts and ideation there is in actual attempts. But some of the kids we end up interviewing are kids who are typically they're depressed, or their grades have slid, or there's abuse going on at home, and some of the kids' option in their mind is to be suicidal. So we're always trying to assess for that. That's the number one priority to us. But it's a hard thing to know if they're really going to attempt it or would succeed at it or not. So that's that, and levels of depression we're really concerned about. Do you think there's been some changes in you?
Yeah.
Mm-hmm. What kind?
I guess emotionally, I don't
I try to tend to make things not get to me as much. I try to realize that it has to be sometimes that way, and some things just happen that way.
So some things you can change and some things you can't change. Yeah.
What do you think you're getting from this? You keep coming back, so you must.
I'm getting a good friend because I'm learning, to trust people more. There are people out there, and I'm learning to be more independent in myself and my feelings. That it's okay to show how you feel sometimes.
We picked San Jose because this city is doing as good a job as any we found in the entire United States when it comes to providing access to health care for children and adolescents. But San Jose is not utopia. The clinics here reach students in 20 public schools, but there are 182 public schools inside the city limits of San Jose. Make the argument that this is economically justifiable, that this is a good investment.
I think prevention is always a good investment. Many of the children we see who have diseases or problems that we can catch either at an early stage or that we can prevent. Every earache that you prevent from going into deafness, every time you catch a child with anemia before they develop another problem, every strep throat that you treat that doesn't develop into a more serious problem.
The state of California spends approximately $4,000 per child to educate them. As we look at the budget this year in California, the only increase that was given was for the prison system. It cost us $30,000 a year to keep a prisoner. We need to think very carefully about our future and what we have for our kids and put that money into prevention. Put it into educating the child, putting it in to make sure that when he's at school, we can give him the best.
Do you think that deep down this society really cares about children?
I think one of the problems is that children don't vote, can't vote, young children. I think they care, but I'm not sure they're always willing to put their money into the caring.
Children don't vote. Children have no power. We heard that over and over.
Children don't vote. Children have no lobbyist. And children have not had anyone to go out and fight for their rights and their needs. And so many of the children are poor. So they have no voice.
No voice, no vote, and very often inadequate health care. 4 out of 5 of the cases in most urban pediatric emergency rooms ought to be treated in a doctor's office. They're not emergencies. But urban areas don't have enough doctors. Dr. Arthur Klein, Vice Chairman of Pediatrics at New York Hospital, would like society to do more.
It's an investment worth making, because if we don't address the health care issues of children, if we don't provide for them an umbrella of health care that makes them very healthy and functional human beings, we're in essence mortgaging our future as a country and as a society.
Are you trying to tell me that it's in my interest that those kids over there get healthy?
Absolutely, no question about it. No question. It's in your interest because we have a lot of jobs in this country that are going to need to be filled by skilled people. And to learn, you have to be healthy.
There it is again, that connection between health and learning. You may remember the 6 national education goals that Bill Clinton helped establish back in 1989 when he was governor of Arkansas. Those national goals have a purpose, to make the USA number 1 by the year 2000. Unfortunately, we're already number 1 in some ways we can't be proud of: teen pregnancy, alcohol and drug use, and infant mortality. In education, we have some more rankings we'd rather not have. We're number 1 among industrialized nations in ignorance of math, biology, and other sciences. We're second in the world when it comes to days off from school. Only kids in Belgium have a shorter school year. But we're number 1 in television viewing. To Dr. Jocelyn Elders, the system is upside down.
Everybody says, well, we don't have time to be teaching all this health stuff. We've got to teach reading, writing, and arithmetic. But you can't teach reading, writing, and arithmetic to people who are not physically, emotionally, and psychologically fit. Our system pays for dying, not health.
What do you mean by that?
What I mean by that is that out of the money we spend on health care each year, 90% of our healthcare dollars is spent on the last month of life. We spend less than 1% on preventive healthcare.
We'd like to end this program on an optimistic note. It may be that without anybody realizing it, healthcare reform is already underway in Head Start programs and in school-based health clinics.
Are you ready for your prize?
In these programs, Hugo and other children are receiving, sometimes for the first time in their lives, proper medical attention, free of charge, regardless of income or insurance coverage. Parents are learning preventive care, and children are learning to take responsibility for their own health. But at best, it's a tiny step in the right direction. We began with a question: how healthy are our children and adolescents? Given that we're the richest country in the world, the answer has to be not healthy enough. If our children were healthier, we'd all be smarter. And as we like to remind everyone, learning matters. I'm John Merrow. Thanks for being with us. See you next time.
To find out more about this program, visit us at PBS Online at the internet address on your screen.
Learning Matters is made possible by grants from the Lilly Endowment of Indianapolis, Indiana, and the Pew Charitable Trusts.
Funding for this program is provided by Annenberg CPB to advance excellent teaching. For information about this and other Annenberg CPB programs, call 1-800-LEARNER and visit us at www.learner.org.